here are some tips for coding ICD-10 diagnostic coding for mental health codes. For diagnostic criteria, you want to make sure you're consulting the Diagnostic and Statistical Manual of Mental Health Disorders, also known as the DSM. Right now, they're on version 5. Again, they outline the diagnostic criteria for any mental health diagnosis, substance abuse diagnosis. It's all in there, and it's very clear what the parameters are in order to diagnose a patient with those specific mental health conditions. Number 2, remember, there are multiple severity levels in many behavioral health diagnoses. So make sure you include the severity level in any diagnosis where it is required. You want to look at diagnoses such as bipolar, depression, major depression, those substance abuse conditions. Mostly all of those will have different severity levels: mild, moderate, severe. Some of them also are coupled with psychosis, even mania. And it's that same way with substance abuse as well. So you definitely want to make sure that you're identifying those severity levels, because it can make a good difference, and we'll go into that. Mental health severity levels range from mild, moderate, severe, and there are symptoms outlined in the DSM-5 of each. Patients have to meet certain criteria, and we'll go into that in order for you to diagnose them with those different severity levels. Always refer to the most current version of the DSM for your diagnostic criteria. Again, we're currently on version 5. I believe it took them like 20 years to update from version 4. So it's not something that's updated very often, but they do make changes to it sometimes on an annual basis. So you just want to make sure you're using the most current version of that diagnostic material, the DSM-5. And remember, specificity is everything. Accurate mental health diagnostic coding strongly depends on our providers being as specific as possible. We'll go into a few examples next. Okay, so diagnosing major depression disorder. This is a big one as far as your primary diagnosis. A lot of our mental health patients are diagnosed with depression. And so then there's a lot of opportunity for us to do better with the way we are diagnosing and making sure we're using those severity levels. So we'll take a closer look. Symptoms of depression. Depressed mood, such as feelings of sadness or emptiness. Reduced interest in activities that used to be enjoyed. Sleep disturbances, not being able to sleep well or sleeping too much. Loss of energy or a significant reduction in the energy level. Difficulty concentrating, holding a conversation, paying attention, or making decisions that used to be made very easily. Then the last one, suicidal thoughts or intentions. So one of the 2 core symptoms must be present for a diagnosis of depression. So number 1, persistent low mood and feelings of sadness with or without crying spells. Number 2, marked lack of interest in a previously pleasurable activity. So when it's coupled with all 4 of these components, that's how you get the severe. And so a lot of the severity levels depend on having 1 or 2, 3 or 4, or all. So again, that's why you want to make sure you're well versed with what is required for each severity level. But if you have a combination of some of these things, but it's only hitting 2 boxes, then you're going to go with the lower severity, probably mild. And then, as you have all of them, it would be more of a severe. And again, you also have the opportunity to add the psychosis or the mania in bipolarity. So just make sure you're, consulting that DSM-5 for those added criteria. Okay. So when you look at that criteria again for diagnosing major depressive disorder, 7 additional related symptoms are there as well. Sleep pattern disturbances, change in appetite, tiredness, sluggish movement or agitation, difficulty concentrating or solving simple everyday problems, feelings of guilt and or worthlessness, thoughts of death or suicide. The three levels of depression characterized by the following: mild, and this is kind of what I was touching on the last slide, mild, one core symptom, and usually no more than 4 related symptoms. So one of the core, which would have been one of these, and then an additional 4 related, which would be 4 of these. Okay, so moderate, both core symptoms are present, as well as 4 of the more related symptoms. Severe, both core symptoms are present in most, if not all, of the related symptoms. So again, as you're diagnosing, when you're doing, your psychiatric evaluations or any sort of assessments, you want to pick up on some of the language the patients are using to help you get to the point where you're noticing their sleep patterns, their eating habits, whether or not they are suicidal. And of course, you have other assessments if they are that you'll need to do. But that's how you get to these different severity levels. Okay. And so diagnosing major depression disorder. So for a final diagnosis of major depressive disorder, the provider would select the code F32.9 for major depressive disorder, single episode unspecified. That's what it maps to. Okay, so that is just basic depression. Okay, if this is not the patient's first time being diagnosed with depression, then you want to make sure you're using a diagnosis that includes recurrent, because this would be another additional episode. It wouldn't be a single episode, because single episode indicates that this is their first time suffering from major depression. So again, if you're just putting major depressive disorder or MDD, it will map to just basic depression, which is F32.9. Okay, so again, if it's another occurrence, you want to use a code or a diagnosis that will have recurrent episode in the language. Okay. Also, code F32.9, which is just major depressive disorder, is the most mild of the mental health depression disorders, and it's typically not a severe enough illness to justify an inpatient stay. So if inpatient is recommended, or if this person is already admitted to a behavioral health facility or to the behavioral health unit in a hospital, just giving them the diagnosis of major depression sometimes isn't enough to support them being there on an inpatient level, unless you made it a secondary diagnosis. But as a primary diagnosis, it usually isn't enough. You will need to add the severity level. Mild, usually you probably want to go with moderate or severe. Okay, of course, that's if they're meeting that criteria that we talked about previously, but you definitely want to make sure you're adding your severity level. The F32.9, just major depressive disorder, is typically seen in an outpatient setting. And it's okay if, a lot of times patients come in with the severe depression, and once they go to the outpatient setting, it's kind of reduced. They're a little bit better, and it just goes down to a lesser severe version, which could be the major depressive disorder. Important consideration: without documentation of the severity level, the diagnostic code will always map to the lowest severity level. Okay, so that's basically what I'm saying. If you just put major depressive disorder, it's going to code as F32.9, which is the lowest severity, which is just basic depression. So if this person is meeting criteria and they have those 2 cores and those other symptoms as well, then you definitely want to make sure you're using a more severe diagnostic code, giving them more severe specificity on your diagnosis for major depression.